All right, good evening, everyone. Thank you for your patience as we let everyone log on and click their Zoom links and get those going. And to those joining us by phone, thank you for doing that as well. I really appreciate everyone taking the time and joining us this evening to learn about the work of our Bring the Penguins Home task force and everything that we've been doing to prepare for the fall. And I wish I could give you a definitive answer on so many of the questions that you asked leading up to the webinar tonight. But all throughout this process, our goal has really been to take a measured and data-driven approach to provide for the safest and best environment for your students when they arrive back on campus in the fall. And at this point, I don't want to proceed down a certain course of action before we have all the facts and make sure that our plans are consistent with medical and governmental advice. And as of today, Massachusetts hasn't released, its guidance for K-12. I was on a webinar with the Secretary of Education this past week and the working group for higher ed, and they were giving us their thoughts. I was on another webinar with the K-12 working group and also getting updates from them. And they're saying they're going to release guidance in mid to late June and a final plan in mid-July. And while certainly we want to give you definitive answers before mid-July so that you can plan and be here, we also want to make sure that we have a plan in place that can at least meet those minimum expectations. But as I said before, we want to surpass and exceed those expectations and really feel like we need that guidance from our, particularly state government, from our K through 12 working group with the Mass Department of Education. We need it for different athletic associations. And so what I'm going to do tonight is give you an overview of our thoughts, what we're doing so far, what our plans are, how we're addressing some of the challenges that COVID-19 presents, and generally, what we're working on to bring the Penguins home in our task force. And I'll just start with a brief review. If you were on the call last time, these names may seem familiar. If you're not, just want to give you an update or tell you some of the names of the folks that are on it. Bill Rouse is our senior advisor. He's project manager of the Bring the Penguins Home task force. He's a senior advisor at Ox, which is an operations consultant company. Bill's keeping us honest, keeping us on deadline, working with me and our senior team to progress through this, work with the subgroups, work with the senior group. And Dr. Adriana Bravo is one of our medical experts on the steering committee. She's the boarding school medical director at Episcopal School in Alexandria, Virginia. She's been the medical director at Salisbury Schools. She's worked in a number of other boarding school environments and has training from Johns Hopkins and Dartmouth. So we're happy to have her as part of our group. You also may have remembered that we brought on board Dr. Christina Hermos. She's a pediatric specialist in immunology and infectious disease at University of Massachusetts Medical. And Dr. Ann Hohen, who is on the Dartmouth, Return to Dartmouth Task Force. She's an epidemiologist in the Dartmouth School of Medicine. And they are both on our steering committee and giving us their perspective. And of course, they join our own medical team, Dr. Michael Muchler, who has been with Cushing as the medical director since 1996. And many of you know Sue Casey, who's the director of health services here at the Academy. And health services are really one of our primary areas of focus as we work to bring the Penguins home in this effort. And last time when we spoke, I focused mainly on this Bring the Penguins Home task force and the membership, some of the medical expertise that I just spoke about and reviewed. But we formed some subcommittees there, which we're beginning to form. The last time I spoke a few weeks ago, the Student Experience Committee, which I'll talk about, some of the work that they're doing, health, safety, and wellness, of course, which involve our medical experts, campus operations and logistics, which is a huge undertaking of facilities and other areas, which I'll get a little bit more into, business continuity, which is HR, financial planning, all those different areas, and of course, communication. We'll continue to do these webinars, we'll continue to send letters. My goal is to be, and our team's goal is to be transparent in this process, to be inclusive and to communicate with you and to have that communication be two-way. Of course, you can all access me anytime here in the office, whether it's email, phone call. Some of our international parents have me on WhatsApp and on WeChat. And also, as I said before, we want to hear from you. And I'm happy to, again, have individual conversations and answer your questions. If those questions don't get answered tonight. And of course, as I alluded to in the beginning, being aware of our regulatory environment, what federal, state, and local regulations and guidelines, that we have to follow and that are being imposed on us. So keeping that as part of our work and in the conversation with the subgroups, but also in the central Bring the Penguins Home task force. And that also involves, supplies and equipment, PPE, and then training, not only for our own staff, but also our students on maybe physical distancing or what it looks like on campus, or if we have pathways that are one way, and which I'll get into a little bit more. But wanted to give you a general overview on our structure and how that's evolved since the last time I presented. Again, just to reiterate, we really are looking at federal guidance from CDC, state guidance from Mass Department of Education. Although we are not in the public school athletic environment, looking at MIAA, what they're putting out, on the national level, NFHS in terms of athletics, and then locally with the Board of Health, making sure we're in relationship and having conversation with folks there, all distilling down to our central steering committee for bringing the Penguins home, and then vetting that out to our different subgroups as needed to keep our work progressing forward as we work to bring everyone back in the fall. So I'm going to give you a little bit of detail on some of the work of our different subgroups. And really the goal of tonight is to answer some of the, hopefully answer many of the questions that you asked ahead of time. But also I'll open the chat box as I did last time, and you can type in your questions and I'll answer those and give you up-to-date information on where we are, and at least if we don't have the answers to those questions, what we're thinking and what the possibilities are. But the four subgroups, continue to be the student experience, which really focuses on academics, day-to-day student activity here on campus, student affairs, residential life, athletics, extracurriculars, and also work at the admissions office. Campus operations and business continuity, facilities, food service, what does that look like? IT, transportation, human resource, and then health and wellness, which is our medical expertise, health and wellness guidance, recommendations. What are we doing not only to open, but to stay open, and how to handle what happens, if someone has COVID, how do we go from there? What are our policies and procedures? What's our operations manual, where health and wellness informs the operation of every department across campus and those guidelines. And again, communicating with our families as we're doing tonight. So just want to get a little bit deeper into there. Our student experience group is chaired by our Associate Head of School, Catherine Pollock. And on that committee or subgroup are Raj Bala, who's Director of Academic Affairs, Dr. Jennifer Willis, Director of Teaching and Learning, Jennifer Viana, our Director of Athletics, Josh Doyon, our Director of Student Affairs, and Dan Morrissey, our Director of Admission. And all members of the committee bring a variety of experience in their own position and also in other positions in boarding and day independent schools over the course of their careers. And as I say here on the slide, they're really responsible for looking at all areas of student experience and how those experiences will look different in the COVID environment. Considerations, of course, to our own culture, our own mission, our own community, what works well on campus, our mental and physical health and wellness. In the age of the webinar, I was on a webinar with several heads of school this last week with the former Surgeon General of the United States, who recently wrote a book called Wellness. And it was all about mental health during this time and how students are coping not only in the online environment, but now in the summer. And it was a really interesting conversation. So that's another piece of what they're talking about. But also thinking about, taking all of that information, what does it mean into our annual calendar? When are we starting? When are we finishing? Which I'll get into a little bit more. Our daily schedule, does that need to change? Does lunch need to be staggered? Looking at where we eat or other types of gatherings, classes, all of the things we do on a daily basis. What are those? How do those look differently? Making sure academics can continue, which is an absolute priority. We want to be on campus and present. But if international student may have a travel delay in getting here for a variety of reasons, making sure that we're working on a hybrid approach so that an international student can join online and then seamlessly integrate into our academic curriculum when they come on campus and join class in a face-to-face method of learning. And how would that work? One thing is that all of our teachers right now actually are currently working on online teaching certification through Duke University. to give professional development so that they can take, the great effort and hard work and experience that they had in the spring doing online learning and even upping their game a little bit more, giving them a little more tools in their toolbox to bring to that hybrid for international students who may be delayed in joining us. So we're committed to, continuing the academic experience for all of Cushing students in the fall. Athletics, I know, there were lots of questions there. And again, Jen Viana being on that committee and being in touch. Jen is actually an officer in NetSAC District 3. She's the secretary of the board there and involved in our athletic association, and certainly provides information from that group, but is also monitoring, as I said, Massachusetts Interscholastic Athletic Association, which MIAA, NFHS, which is the National Federation of High School Sports. We're looking at NCAA, a variety of sources to be sure that, if other schools are able to play, of course we will be as well. And I'll talk a little bit more about that on the next slide. Similarly with arts, making, trying to provide the most expansive experience possible for all of their students in a variety of programs. Student affairs and residential life. What does dorm life look like? Are students living in groups or pods that they will then be either in class or in teams with? That's something else we're looking at. Again, no definitive decision there, but just want to give you some of the topics and areas that we're having conversation about and we'll be making decisions about. Extracurricular activities, what do those look like? Maybe more on campus or certain areas that we can go off campus. International students, which I spoke a little bit about with the hybrid approach. And then DEI work, diversity, equity, and inclusion. And we want to prioritize anti-racist work as we think about our plans to reopen. It's clear that Black students and other students of color have been disproportionately impacted by COVID-19 and also the racial unrest in our country. And we want to make sure that our faculty are trained and are aware, and that we're providing the best environment for all of our students to return in the fall when we reopen. And that's absolutely part of the conversation that this subgroup is having, and that will then eventually come out to the senior steering committee and then to our overall plan for the fall. So a lot of work there that Catherine and her team are taking on. They've met several times already. They have weekly meetings, homework, subcommittee meetings, and so I expect to see a lot more out of that group and our other subgroups as time goes on. But again, wanted to give you an overall sense of what the groups are working on, the topics that they're looking at, and the road that we're heading down as we get ready to open in the fall. Athletics, I spoke about that before, but I wanted to give it special consideration as there were an abundance of questions regarding athletics and even some on specific sports. And at this time, we just don't know. Of course, our aim is to play. Nobody wants to get back on the field more than Cushing does. It's not only they're not only essential programs for many of our students, but they're also programs that are essential for building community and coming together. And so it's definitely something that we're hoping to return to as soon as possible. We know it'll probably be a phased approach maybe, as you see professional and colleges return and they're doing it without fans or in limited ways. And so, we're gonna do that consistent with guidelines, meeting minimum expectations and then exceeding them. I put some examples here, publications from the end of May. The NFHS put out some guidelines, the NCAA as well. And both of those publications right at the beginning said, pretty much follow your state guidelines, follow the recommendations from the CDC. And of course, in Massachusetts, we're still waiting for those. I thought the article by Dr. Niehoff on May 27th about patience is needed, right? As we start to look at high school sports, performing arts, what are those going to look like? We just don't know, but certainly it's on our mind. It is a priority. And if schools are playing, Cushing will be playing as well. And we want to make sure that we communicate that and that you're aware of that. And we will certainly keep you posted as that progresses as we head towards the fall. Campus operations and logistics, chaired by Paul Silva, our CFO, and Ed Kirk, our Director of Master Planning and Engineering. Our members on that subgroup, Mark Harris-Mowitz, Plant and Property, Pete Gilchrist, also in that department, Danielle Lucas, who's the General Manager of Brock & Company, Donnie Connors, does Transportation and Student Activities, Bob Machachi, who's our campus safety coordinator, and Bruce Lemieux is our director of technology. And really this work group is responsible for all areas of campus operations, including furniture, room layouts, cleaning, janitorial, dining considerations, how food is handled, how it's going to be served, how back of house works, repurposing space as needed, transportation, security. And this team has really been busy. They've already measured every single space on campus. They've calculated square footage available. They've looked at different models from different states. We don't have the Massachusetts one yet, but we've looked at, okay, with this square footage in this room, according to this state standards, we could fit this many students, different state standards and a different way of placing students in the room. We have this model, this number of students who can fit into the room. So a lot of work has already gone into this group. This is also cleaning, looking at physical distancing and shared spaces, athletic facilities, maybe zoning the campus for different activities, really reviewing all facilities, spaces, cleaning, food service, all of the ancillary programs that happen on campus to support the health and safety of our students, making sure that cleanliness, health and wellness is involved, to support all operations across a variety of areas on campus. So that group has been busy and will continue to be, and it is absolutely critical to the work of this committee, and as we look to the fall and bringing students back. Business continuity is more HR. Paul Silva is also the chair of that group, with Kathy Melanson, our controller, our human resources, again, Bruce, director of technology, considerations related to maintaining financial sustainability, personnel, IT, infrastructure. So again, a subgroup that's important in terms of long range financial sustainability, personnel, and how our adults are working and living here on campus. And of course, our health and wellness subgroup, which I spoke a little bit about at the beginning of the presentation, with Dr. Bravo as the chair, and of course, our medical director, Michael Muchler, and Sue Casey, Dr. Aramos, Dr. Owen, John Price, our director of counseling, and Dr. Lister, our adolescent psychiatrist, is also a member of that team. And they've had many meetings as well, several weeks into that process. They've also had some subgroup meetings looking at, okay, what would happen if a student here, came back with COVID? What would that look like? What would our policy and procedures be? What are our prevention? How does repopulation of the campus look? What are some approaches there? How about surveillance and monitoring of the health on campus? And then also continuation of essential services, right? We still need to maintain the health center to do all that they did before, which was a lot of work and service to our students. How do we make sure that that continues to be even better than it was, and also have a plan for the challenge of COVID-19? So certainly, again, a tall order for this group, but they've really been working hard for your child and for our students to have the best answers for the fall, as we look to not only repopulate the campus and open, but also stay open over the course of the year. And in that light, we've also added, because health and safety is such a priority, Magnus Health, which is a software system that's really going to handle the way that you'll see it as families, as forms on your side. Our medical forms, even some of our admission forms, will go out through Magnus Health. And one of the critical components, and also a reason that I included it tonight in our presentation, is because we're going to be sending these forms out in the next couple of weeks, and it is absolutely essential that we all, as families, I have kids here too, and do forms at the last minute. I'm guilty of that, so I want to make sure that we're all doing them as early as possible, using Magnus Health, getting information to our healthcare team. Magnus Health is capable of a whole host of functions that I put here, which we will utilize over the course of the school year. But it is an area that we feel like it is a tool that we feel like will help us to be even more efficient and better at those essential services that we spoke about, and also will help us to meet the COVID-19 challenge when we're talking about communication, treatment, tracking what happens with our students on that side as well. So worth mentioning, and also I put it in here for all of us as parents to meet those deadlines of turning in forms, making sure that all the pieces are in place so that our health team, they have so much to do to meet this challenge. and chasing records or physicals or everything else is something that we can all prevent if we get on the same page and get these forms in as soon as possible. So put that in there as a PSA for tonight. If you have any questions, I'm certainly happy to answer those about Magnus Health and its functionalities as we go forward. Another piece that's really important to our arrival and start of school is what our medical team is calling the 5-prong testing approach. And we really want to use testing as a tool to maintain the health and safety of our campus. If we look at overall risk as a gauge, the way that I like to picture it, right? If it's something that's up high, if we do testing at a 5-prong approach, it goes down significantly. If we do PPE and masks, it goes down some more. If we do dedensification, maybe it goes down more. The way that we interact in the dining hall, right? It's not self-serve, it's somebody serves us, down even more. And all of the things that we're going to do across campus can really lower that risk for everyone. Testing being one of the most critical. And we're looking at pre-entry and prior to arrival testing, whether that's an antibody test or a COVID test, and how many days before, waiting on guidance. Again, I had mentioned the CDC hasn't given guidance for colleges and universities yet, and I'd really like to see that. Our medical team is still waiting to see what Massachusetts will put out. And also, following the science and looking at best practices at the time. And so as we're waiting for that guidelines and to see, it seems like, things are changing almost on a daily, weekly basis that will inform our eventual decision onto how we want to repopulate the campus, which a first step is that pre-entry prior to arrival testing. And then point of entry testing, right? Arrival on campus, what will that testing look like? And of course, we want to probably arrive in groups or segments, which we usually do anyway. And maybe we want to draw that out a little bit more. We've been in conversation with testing companies. We've been in conversation with our local hospital, and are pretty far down a path where we're getting close to having these points laid out. But want to make sure that they're tight so that when we do announce when we're going to come back, we can say this is how we're going to come back, this is the testing that's going to happen, and have a repopulation plan in place so that we're all aware of the way that we're going to come back, the way that we're going to bring those penguins home. And then, of course, a point of illness testing. If somebody is sick and displaying symptoms and has concerns, how we handle them, and then how they're tested, and then doing the contact tracing, and those close contacts are tested. And then finally, when someone, say they are quarantined or isolated, testing them before they can return to the general population. So we really believe, through the advice of our medical group, that this is the best way to utilize testing at this point, and also to bring down that risk to the rest of the community by providing the safest environment possible. Again, I bring this up just to show you Bring the Penguins Home Task Force and all the different areas they're focusing on. I mentioned all of these so far, but it's a multi-pronged approach in addition to testing, again, to bring that risk down to the rest of our community. We continue to monitor public health. Massachusetts Dashboard Public Health Indicators is a daily dashboard that comes out. On the last presentation that I did, we had May 18th as a date, and it had shown, when the dashboard started on May 9th all the way down to May 18th, which was a significant decline. And then also, wanted to share with you this evening that trend has continued to be very positive in Massachusetts. So since the 18th, now we're all the way about 3 weeks later to June 7th, right? So significant decrease there. Again, here, May 18th, significant decrease again, and on and on. And you can find this information on mass.gov. But another piece of the puzzle as we continue to monitor public health and then react in our own state and local to area by our practices on campus. And that'll be a continuous and necessary step when students are back here. And as we talk about that dimmer switch that I spoke about before, if you remember, and I'll talk a little bit about that as we continue tonight for resuming activities here on the Cushing campus. Again, we're continuing. I shared with you last time, and I think it's worth mentioning again, that students are returning to class around the world, and of course things look different now than they did before. But we're continuing to keep in contact where students are already returning to class. I was on a call this last week that NIASC, which is our accrediting group, did with schools from Denmark and Germany, and they had students, teachers, and administrators talking about their experience, colleagues. that I've worked with over the years in South Korea and Vietnam, speaking to a head of school in China, another in Thailand, and also the way that they're managing COVID. If they have a case on campus, what does that look like, and how are they staying open? So those have been really great conversations that we will continue to keep those contacts with our colleagues from different countries. And what we're also beginning to see are themes, right? We're beginning to see schools in all of those countries have similar responses with, strict guidance and physical distancing, maybe clear routes and movements for traffic in buildings, like, one way in, one way out of the building, or one particular doors and only an indoor, some other doors are only outdoors. The way they do transportation, certainly the daily and yearly schedule being modified. Food service is a big one that I spoke about before, advice and expectation about high-risk individuals, cleaning, visitors, all of the things that, you need to think about when you're talking about maintaining a healthy community in this environment. Of course, no borrowing from other students, maybe cleaning your own area more routinely or at the end of a class before the next group of students come in. That could be, something that you do before leaving the classroom. We're seeing that come up as a simple and easy strategy that schools are doing in the classroom. And also parent support. We may require you bring a few masks to campus or your own bottle of hand sanitizer. And then the screening ahead of time, which I spoke about with testing. We're seeing, some schools around the world that ask their students and families to sort of isolate at home for a certain period of time before coming back to campus. So again, it's good to be in contact with those schools from around the world, get those practices into our own thinking, and then find the solution that's best, not only that complies with our own medical team's advice, but also that's right for our school community and culture. Next steps as we approach. So I put up this slide last time, and we have more check boxes here, but we've certainly, done our committees, assigned roles, our schedule and frequencies happening. We're identifying our reopening phases. Still looking at a preseason and new school year. We're hoping athletics are able to happen and continue, but waiting to see, what that looks like, and developing a timeline for internal decisions announcements, which, we've done some of, but haven't done a final timeline. So don't want to put that checkbox there. And supplies and equipment, again, we've, been way into developing those lists and what we need, but, want to check that off when it's complete. And then, of course, continuing to meet virtually and building in redundancy and contingency plans for what the next few weeks may bring. So all of that translates to working to maintain a healthy campus, and that, phrase that I mentioned before, it's not only about coming to campus in the process of opening, but staying open. And the image that we used before to talk about this was the light switch between sort of the old model and the new model, where, typically our school, Cushing Academy, is just in session or out of session. And when we're in session, everything's happening as it normally would. And when we're off, students are away from campus. And that our new model needs to be this dimmer switch. And that when we enter campus, right, if we think about if the dimmer switch is all the way to the top, that means that school is open and all programs are happening as they normally would, with no PPE and anything like that, safeguards. And, we don't anticipate any school will be here until there's a vaccine or a treatment. So it's about being able to move this dial. Maybe when we come on campus, it's down here where we're open a little and there's more restrictions on physical distancing. And once testing happens and everything's in place and the public health situation hopefully improves, that this, dial might move up a little bit, or it might move up in certain programs and down in another, right? For academics, it might be in one place. For athletics, it might be in another. For extracurriculars, it could be in a whole different one, or arts in a different place. And so really that's going to be in reaction to state and local guidance, federal guidance by the CDC, what the public health situation dictates, and our own community and culture here on campus at Cushing. And I do think it's worth repeating that, we really want to take into account and meet not only the minimum expectations of that guidance placed on us, but also exceed that to create the safest environment possible. So all the different areas that we're talking about that we really want to have in place before we make an announcement of here's how we're coming to campus, here's the date, here's what it's going to look like, here's who needs to come by when. are certainly testing and facility screening, rules on physical distancing, personal protective measures, what the schedule is going to look like, not only academic year, but daily schedule, who can come in and out of campus and when, what does that screening process look like? Of course, regular hygiene on campus. Do we need few extra minutes between classes to wash hands, cleaning, sanitizing, and disinfecting, when, where, how? Does all of that happen? Does it start with, kid at the end of class wiping down a desk? Does it go to extra folks coming in the evening? So we're looking at a variety of options, but these are the areas we really want to narrow down before that announcement is made. So getting to that, our normal start date for school was September 7th, which isn't even on this calendar, but it's a week after the 31st, right? Typically Cushing's first day of class is on Labor Day, and students would arrive in segments before that. What we're really looking at is the possibility of an earlier start, either 2 or 3 weeks earlier. I said to our faculty at our end of year faculty meeting that, they should be ready to keep their calendars open and flexible from late July to early August, because if we did start, say, a first day of class on August 17th, faculty would need to be here much earlier because student arrival, maybe international students would arrive 2 weeks early, or however we wanted to structure that repopulation approach, and still waiting for guidelines and recommendations on that. But I wanted to give you an idea of the conversations that we're having so that you're aware, of what the possibilities are when we communicate that. Certainly my goal is to communicate that in the next 2 to 4 weeks. Ideally, it would be maybe right after the holiday of July 4th. Our timeline is to communicate with you every couple of weeks, but just wanted to be transparent and give you a sense of those are the conversations that we're having, is to start early and perhaps end early here on campus, and still allow for plans for athletics to continue as long as they're able to. But certainly I'm open to your feedback, conversation about that, but also wanted to put that information out there so that you were aware. And so we're going to ask for your feedback. If anybody who's on the webinar and registered tonight, what we're going to do is at 8:15 tonight, you'll be getting an email from Cushing, and it's just going to be an open-ended feedback form, not necessarily a survey, but just a place for you, a narrative form to just give us a little bit of feedback on communication so far, messaging, start of school, what you're feeling on your end. I think that would be helpful also as we have state guidelines, federal guidelines, local guidelines, information from the CDC, best practices from all of our athletic associations, their recommendations. We also want to know what our families are thinking. Certainly that needs to be part of the conversation, and we know we can't meet everybody's needs in this, and that we need to follow the guidelines, and certainly want to do so in a way that matches, as I said, our mission, our community, and our culture. And we also want to be sensitive to your feedback and give you a place to do that and share your feelings with us on your thoughts on what you've seen so far. So please do that. I'm happy to read it. And if you're not comfortable putting it in the form, as I said, email, call, text. Many of you have my cell phone, and I'm happy to share that with anyone who would like it. And as I said, our international families, most of you have my WeChat and my WhatsApp, and happy to share that as well. But really do want to hear that feedback, so please pass it along. And I appreciate the questions that you shared at the beginning tonight, because that's also a great way for us to get a pulse on maybe some worries or feelings, thoughts you have for the next school year. So just a timeline overview. So tonight was our second webinar to families, and we're going to put that feedback out. We'll give you about a week or so to get it back to us. So sooner the better. If you get that back in the next couple of days, that'd be great. But we also want to be sensitive to your busy lives and schedules, and make sure that you have time to do that. My goal is to do 2 weeks from tonight a third communication, highlighting again, here's what we're thinking, here's where we are in the process. It may not have news to say this is when we're starting or this is what we're doing, but again, the picture will begin to be more and more clear with every conversation we have. And I'm hoping that before July 9th, before that fourth communication, we can say, here's when you're coming back to campus, here are the groups that are coming at which time, here's how we're going to do it, here's the testing we want you to have before and at campus, here's what it's going to look like before that July 9th date, say July 9th at the latest. but I'm hoping after the 4th to get that out to everyone. So just to give you a sense of where we're heading in our timeline as we progress down this road. I also want to give the opportunity for questions. I didn't want it to be too long on the presentation side tonight. I know there were many questions about athletics, which my goal was to answer in the presentation. It really is that we don't know yet. If schools are playing, certainly Cushing, will be playing as well. Other than that, in terms of the winter season, hopefully by then we will be able to be playing as fully as possible. But those recommendations and rules around what that looks like, who we can play, who we can't, we just don't have yet, but certainly we'll react to when we have them. So feel free to put your questions in the chat box, and I will answer those as best I can. We'll shoot for an hour as I did before, which gives us almost, I think, just check the time, 20. So I'm happy to stay on, 20 minutes, half an hour, or as long as it takes to answer your questions and go from there. So we have a couple questions. Have we considered creating a closed container on campus where students come in and then one time and leave at one time? It might be a challenge, but would decrease contacts for outside sources. So yeah, that's been a conversation, maybe not in the way of creating an absolute bubble or lock zone, but creating rules around to limit the comings and goings on campus. And when students do come and go, what does that look like? Do they need to be tested? Probably will depend on the public health environment and the recommendations of our medical team, but certainly has been part of the conversation. We actually feel like we're in an advantageous position because we are 90% boarding, our 10% of our day students, but half of those are faculty children who live here on campus, who I would consider part of the sort of Cushing Academy family unit, if you could think about it that way. There is and 90% of our faculty live on campus as well. And we're also thinking about, there are people in offices who, have worked remotely at this time. Maybe that's something we want to continue to limit the coming and going at first. It's almost, again, the dimmer switch happens in a number of areas, and maybe it happens on that side as well with our own personnel. So yes, that has all been part of the conversation. With the ultimate goal of decreasing contacts with outside sources. Absolutely. And maybe it's in the first, maybe the dimmer switch at the bottom is limiting contacts in the first 5, 10, 15 days, 20 days, and then it goes up incrementally as the public health situation warrants. In terms of housing, are you thinking students having more singles for dorms? We batted that around too, spoken with the higher ed work group actually this week about that. Spoken with other schools. It seems right now the recommendation is no triples, which we don't do on the Cushing campus anyway. We do have a number of singles here on campus, which we could reserve for maybe students who have a risk or a family situation where that's needed. But certainly we think that creating doubles as a family unit or creating cohorts or pods or a group of penguins is a waddle, which is another name for a group, which could be, a group of students could be a family unit, and then those doubles could work. And that seems to be, from the guidance and advice that we're seeing, something that a lot of colleges and boarding schools are looking at as an acceptable practice, at least as of today. As a private school, are we required to follow Department of Education public school guidelines in Massachusetts? So we are required to follow state guidelines for K-12 institutions. Although we are a private school, we still will be required not to follow curricular guidelines, but in times like this, we would have to follow guidelines in terms of density, distancing, those sorts of things. What are you seeing from other schools internationally? Are some sports more likely to be able to continue versus others? That's really interesting. I spoke with a couple of schools. The model internationally is a bit different. A lot of international schools don't have sports associated with their schools, or they're more like club, sports within the school, more interscholastic. So it's a little bit of a different model than U.S. schools, but certainly they're doing PE and activities like that. But in terms of playing each other, I haven't seen that. But it's a great question that I'll certainly ask the next time maybe a little bit more specifically. Some of the international American schools do that, so that could be a great place for me to look for that answer. When can we expect to receive enrollment papers? So Magnus Health in the next couple of weeks. So we're setting for a deadline of ourselves before July 1. You will receive those enrollment papers through Magnus Health, not only the health forms, but also the other paperwork from the admissions office. All the enrollment forms will get out to you during that time. So you should see that very soon. Is it likely we will not be having a family weekend? So I don't want to say that right off the bat. If we're trying to limit the comings and goings from campus, and also, the exposure from having large numbers of people on campus, the answer to that would probably likely be that we wouldn't. But again, public health situation will dictate that. Maybe we could do something virtually. Just not sure at this time. If a domestic child is diagnosed with COVID while at school, would you expect them to go home until well? Yes, we would. So one of the things we're asking international families and all of our families is to really have a plan to be able to pick up your child or get your child to a place off campus if they are tested positively. Of course, we will care for a child who needs care. It's like our medical team is saying it's more likely than not that a student who's diagnosed positively would either be asymptomatic or have light symptoms, but we really want them away from campus while they're contagious, so that they can work through the illness and then get tested to come back to campus. So that would be the expectation. What is the earliest arrival on campus we are considering? I would say early August is the earliest arrival on campus we are considering at this time. And we will certainly get you that hard date around the 4th holiday, if not shortly thereafter. What is the percentage of day students? So right now we're about 10% day students, but as I said, about half of those day students are faculty children who live here on campus. So it is a pretty small number of students who are coming and going from the campus each day. Will you mandate single rooms? At this time, it doesn't look that way, but we will continue to react from guidance as we move forward. Is Cook Hall still on schedule? Cook Hall is still on schedule. It's risen out of the ground. The roof is on in terms of the plywood on top of the roof. So the building has really taken shape. It looks like that will open late December, early January. So late December 2020, early January 2021. But it's a beautiful building right in the middle of our campus, and we'll also be redoing the campus green there in front of it. So we're excited for that to be on schedule for an opening in late December, early January. Let's see, I answered a couple of these on residential life. Because COVID, sorry, there's a typo. Because the COVID-19 situation is different in every country, and we have students from around the world, do we plan to divide student arrivals? So absolutely, we're looking at segmenting how students arrive, and that's one of the reasons why when I said early August, even if we start school, say August 24th, we want to build in plenty of runway, plenty of lead time for students to arrive at the appropriate intervals to be sure that they're tested and safe, or even isolated if need be, for a certain period of time before we can bring everyone into a face-to-face classroom type environment. Good question. Let's see. Question about all the time and energy that's going into preparing campus for the safe return. Also like to know, what is the plan to have dialogues about white privilege, Black Lives Matter, and the current civil rights movements with students and staff? Yeah, absolutely. As I said before, we're definitely going to prioritize anti-racist work as we think about our plan to return to campus. And we know that Black students and other students of color have been disproportionately impacted by COVID-19, by racial unrest, and that this is a very important issue. I'll be making an announcement about this in the next few days, if not weeks, to our current families and our greater community of alumni, but absolutely is going to be central to our work and on the administrative agenda for next year. I announced it to our faculty when they left on June 3rd in our end of year faculty meetings. So continue to look for news on that and updates from my office as well as the office of those senior administrators on our team. Thank you for that question. Many have already been discussed, but are you thinking 2-week quarantine for boarding students? So that's really going to be, so the question was, sorry, I kind of mumbled that. Are they thinking we're going to have a 2-week quarantine before boarding students can be physically back to classes? So we're really looking at the advice of our medical team there. And that's why I want to be sure that we have access to testing and that's locked in and ready to go. And as I said, we're already deep into those conversations with the local hospital and a variety of other vendors to provide that. But we're hoping that our medical team with access to testing can give us the exact time of how long that would be. I'm thinking if someone is tested before and they come onto campus and they're tested then, we definitely would want them isolated while we wait for the results of those tests, depending on what type of test it is, but would defer, of course, to the advice of our medical team. So when we announce a repopulation plan, that will absolutely be part of that messaging. Sorry, there's 40 more questions, so I'm just going through. You mentioned the dimmer approach as a way to move away from the on and off one. I assume this approach only works if state governments decides to close schools again. So good question, and we're in conversation. Part of the reason that we've been in contact with the Department of Education, I was on the call with Secretary and with our own Association of Independent Schools in New England, is that we're really advocating for boarding schools to be looked at in a little bit of different light. We are 90%, as I mentioned before, boarding. We are 90% faculty on campus. Of the 10% day students, we are half of those are here on campus. We're away from COVID hotspots. We're in a rural environment. We have a hospital 6 miles from campus. We have our own 24/7 health center. So certainly maintaining a relationship with our local Board of Health is important to that. Making sure that we're in communication with our association and the Department of Education is important to that. But we just don't know what the guidelines from the state will be. And that also is in relation to the dimmer and the on-off switch. So we haven't received that guidance yet, or if there's going to be a carve out for boarding schools, or boarding schools are going to be treated differently. States have varying approaches to that model at this time. So that's a wait and see, but great question. What is the advantage of starting school early? Good question. Well, one of the things we're looking at is if we start early, we can end early. And hopefully avoid the beginning of flu season, and perhaps allow some of our athletes to stay on campus and continue sports for that break, but have maybe only 30% of students here after the Thanksgiving break, and really de-densifying the campus. And allow kind of having the best of both worlds, where we're able to complete the semester, and then having a period where if athletics are happening, and hopefully by then they definitely are, but we just don't know. So we're contingency planning around a variety of scenarios. But that's certainly one of the thoughts there, is to get a semester in, start early, end early, and then have plans to still continue athletics. Maybe have some type of winter room or online program, begin the second semester a little bit late, but don't want to get too far ahead of ourselves there, and really want to see what the guidance and public health situation is. But at the same time, if we can get everybody back, let's do it. Let's get a semester in and then work from there. Reconsidering in early August for international students to be able to begin classes online. Absolutely. Our student experience subgroup is working on a hybrid method, so that if students are unable to come to campus, that they can begin online and then seamlessly integrate into our face-to-face program when they arrive. As for sanitizing, will students be required to disinfect their rooms? Great question. Should happen all the time. All right. But certainly there will be an increased and heightened awareness of cleanliness, both in the academic and residential life spaces. And we will want every member of the community to be a part of that. So absolutely, there will be a increased focus and awareness on the sanitization of all spaces, including rooms, definitely. Will students be assigned a cook hall this school year for its opening? Don't want to assume that's going to be available, although it's on schedule and on time. You know how construction goes. There could be delays. There could be punch lists. But absolutely, I'm very excited that it could come online and give us extra space in the middle of the school year and be ready for a second semester if all goes well. So it's definitely part of our thinking and part of the conversation. Yeah, good thought. Sorry, there's still over 25 questions, so I want to make sure I get to them. A couple of repeat questions here. Looks like somebody joined late, but can we talk about preseason for athletics, please? Absolutely. As I said, for athletics, we just don't have that guidance yet. We're waiting to see what we can and cannot do. We're monitoring National Federation of High School Sports, MIAA. As I said, our Director of Athletics, Jennifer Viana, is the Secretary in the District 3 of NEPSAC, which is the Eastern Massachusetts, Boston area schools all the way to here. So a really significant portion of the New England Preparatory School Athletic Council. And as soon as we have that guidance and what we can do and can't do, we will incorporate that into our practices here on campus as advised by our medical team. So stay tuned. I'm sorry we don't have it now, and I know a lot of our attendees tonight are excited to get going, and we are as well. And if there, as I said, if there are sports happening in other schools, then certainly we want to be a part of that as well. Does the campus have police that serve the community? Yeah, that's actually a pretty good question. We have a police station just 1 minute from campus. It's across the street from our entrance on the southern part of campus. Here in Ashburnham, we have a great relationship with the chief and with the officers there. They're on campus all the time. They eat in our dining hall. They're part here doing details on our construction. So it's a really positive relationship and a very quick response time for them to get over to campus. A couple of repeat questions about response time. Somebody asked if split season hockey will happen. Again, not sure at this time. We want to see what the recommendations are. Again, our goal in all of this is to provide as full of a program as possible in the safest and healthiest way. So we will try to do that in the best way possible, but don't have the guidance yet, but are continuing to work day and night to do so. Will we have the same amount of students? Yeah, enrollment continues to be strong. We have a similar amount of students enrolled. It depends on, of course, how the start of the year goes with students being able to get here. So certainly some may be beginning the year online, and others, those international students beginning online if they need to, and then others being in here, in person or on campus in person. But that's one of the reasons we want to communicate a start date sooner rather than later to allow for our students who are coming from all over the world to begin their plans to arrive for the fall semester. Is advice coming and suggesting the students will stay on campus in terms of trips home? I think that's part of that the way that we're looking at it right now is the way the dimmer switches, right? When we first come on campus in the first, say, 15, 20, 30 days, whatever our medical team recommends, that we want to create that isolated bubble on campus. And then as we continue to monitor and talk with our medical team, the public health environment, what the state of Massachusetts look like, where the student is going, what they're doing. Do we test, coming back, or is there a screening process or an isolation process? All of those will be factored into there as we move that dimmer switch up and down. But certainly at the beginning, at least, we know that we want to keep the community isolated for an extended period of time. Another question about medical forms. You'll see those in the next couple of weeks, but definitely before July 1st. We do have thoughts. Somebody asked, how would we handle an international student who otherwise comes a distance away? Well, right now we're on the Student Experience Committee, getting ready to communicate with families who are international about having a contact in the country. There are, certainly agencies that do that, that provide those services. We would have quarantine and isolation units on campus in case of an emergency, and certainly would have the care of our students, as a priority, certainly. But also want to be sure that for the sake of the student and for the community, that we can put contingency plans into place so that they can be away from campus if they need to be for an extended period of time, and that they can do so within a day or two. Would there be a change in tuition due to the hybrid approach? Well, if a student is international and they're online for an extended period of time, we definitely will adjust for that. However, in terms of being open, if it's a student from the U.S., we would expect that student to be on campus and to repopulate according to our recommendations and repopulation strategy, and that we anticipate a very similar number of weeks in the semester as we do have during each academic year, and that wouldn't change from an on-campus perspective. So the short answer is, for the hybrid approach, if an extended period of time, then yes, that's being considered. If it's a student that can get here, then we would anticipate that student to be here for the full experience, and that wouldn't change. Is it possible that some students will take virtual classes even if they are living on campus? That's something we're looking right now at avoiding. We certainly have lots of square footage on campus and feel like that we can meet the de-densification rules in the classroom. Certainly with the hybrid approach, if there needs to be that as a contingency, or more likely than not, right, we would probably utilize that if someone needed to be isolated or in quarantine, that they could continue their classes in that virtual environment if they're on campus. But otherwise, we feel like we can provide the face-to-face experience for those students who are here. Does medical insurance cover COVID testing? At this time, it does. There's a waiver insurance companies have issued for the coverage of COVID testing. So certainly that would be covered for our students. So for students and faculty that don't live on campus, we're looking at some type of daily screening process. A lot of colleges, universities, and even schools in other countries are doing, a short daily survey, maybe a daily temperature, maybe intermittent testing. So all of those strategies are being considered as we look to how the comings and goings would work for day students or faculty that don't live on campus. How about Convocation and all-school handshake? Well, I think certainly this year the all-school handshake is probably out, or definitely out. And then Convocation is a large gathering, so we'd have to be creative on a virtual way to do that, or a way to do that 6 feet apart, maybe in smaller groups. But absolutely, again, want to provide the fullest experience that we can, while following all the guidelines of federal, state, local, and our own medical team as well, to provide the best environment possible. And the last one is a thank you. So I think, where are we? Oh, just a little after 8. Definitely feel free. I'm happy to answer any other questions you might have by email, phone call. Definitely contact me, anytime, and I'll respond in the best way possible, and give you transparency on what we're thinking in all our subgroups and all our committees. Again, as I said at the beginning, we really want to take a measured approach. As I've said throughout this, we started with COVID-19 the week of January 22nd and had our first communication on the 25th, and used the language of really measured, data-driven approach, reacting appropriately, and also in a timely fashion, but based on data and science, and creating the safest and best community for our students here at Cushing. And so, while tonight you may not have had that answer of we're starting at this certain time and then we're coming right on campus and this is what it's going to look like, do want to let you know that we're continuing with that approach. We are looking for at least the draft of the K-12 guidelines for Massachusetts. We really want to see hopefully how the CDC recommends testing for higher ed. We want to continue to get information from the higher ed testing group in Massachusetts. And proceed down a course of action that we really feel like we can live up to, that follows the advice of our own medical team, that really hopefully can hold up to that 5-pronged testing approach and is consistent with all the best medical and governmental advice at the time. So I really appreciate your patience through this process. Thank you for being a part of the Cushing community. I'm excited to welcome everyone back whenever that may be, and certainly feel free to reach out at any time, and I'm happy to have those conversations as I have been with many of our families. So thank you again for joining us tonight. Thank you for your thank yous in the chat box. It's really appreciated, and I look forward to talking with you again soon. Have a good night, and thank you.